I have had a patient tell me, I will change my religion, but I cannot change my food habits. I come from a South Indian town, Karnataka. There is a saying which says, Uta balamaniಗೆ ರೋಗವಿಲ್ಲ, meaning the person who knows how to eat knows no disease. And ಮಾತು ಬಲ್ಲವನಿಗೆ ಜಗಳವಿಲ್ಲ, means the person who knows how to speak has no fights, or like there's no
diplomacy.
Yeah,
oh my
diplomacy. I was just crossing 50 years of my life. And I was diagnosed with diabetes, and I was looking for alternative options. I did not want to take medications. I looked at the medication, metformin. I turned it over, side effects, bitterness of the mouth. I could feel it even before I actually took the medication. So that's when my quest started. I came across lifestyle medicine, which is a subject in itself, works on the 6 pillars of lifestyle. It's amazing how what happened 7 generations ago can have an impact on us today and the future generations too.
Also a little bit colonial hangover, right?
Yeah.
If you had money in the times of when we were ruled by others, that's the only time you would have access to oil, access to ghee. And so it has continued to represent status in our society, whereas we are facing a problem of like either starvation on one side or diabetes and obesity on the other.
I think lifestyle is very, very important. When you're talking about cancer, it's not so easy because there is different types, different stages and different time points in the treatment course. Because only 5% of cancer is genetic. The rest of it is either lifestyle or environment related. So there is no collateral damage, like if you were giving radiation to a patient from outside, if they are giving for lung cancer. So everything around it could be damaged. It could be a lymph node, it could be breast tissue, it could be lung itself, fibrosis. So many things in that path of transit could be damaged. But here, the beauty of it is we give it internally. So it goes and sits where we want it to sit. And then it radiates.
So 20 years ago, what would have been a death sentence now has targeted therapy is essentially what I'm hearing.
Some of them thought I was crazy. They said, you're not doing the right thing. You're, risking your kidney, you're risking your eyes.
Thank you to the MindSattva community for continuing this journey with me. Season 1 was about laying the groundwork, just starting to touch the surface of what happens when Eastern and Western wisdom come together. For Season 2, I have a roller coaster ahead of us. I've met some of the most interesting people and I had the deepest conversations about karma, about psychology, in a way that I've never discussed before. These episodes are going to be longer and they may be further apart so that we all get time to sit with them. I think as a community, we are ready for this. So let's begin. Welcome to Season 2 of MindSattva.
This podcast is for informational and entertainment purposes only. It is not a substitute for medical, financial, legal, or professional advice. Views expressed are personal and may not reflect any organization.
Welcome to MindSattva, Practical Wisdom for Modern Life. I'm your host, Dr. Mitika Kanabar, here today with Dr. Mythri Shankar at the MindSattva studio. Today, we are planning to have an excellent conversation about lifestyle medicine, about cancer, about living better, burnout, and where to go from there. So very warm welcome to you, Dr. Shankar. Thank you so much for making it all the way here.
Thank you. Thank you for having me. You have a beautiful space and I do follow you. I think you're giving out great tips, a real good service. Thank you for that.
Thank you so much. So Dr. Shankar is the author of this book, Ease, in which I have a chapter as well. Thank you for the opportunity. So I wanted to make sure we get a chance to show this. So this is Dr. Shankar's book.
So this book has been an organic journey more than the destination itself. The name came about, removing the dis part of dis-ease. And we've developed kind of a ease protocol around it where each alphabet signifies something. I'm happy to share it with you and, share my learnings in my lifetime of learnings, which have tried to put it all in a nutshell, to make it more in a simple way, into a simple format, which people can read and make it easy for themselves.
That's wonderful. So it's been a couple years since the book has been out.
I did this during the COVID times, actually. We were all working from home. We had a lot of time on our hands. That's when the whole thought process and the research which went into the book got started. And then it took me about 6 months to 1 year to get it all packaged and put it out there.
I remember you telling me that how many just sheer volume of papers that you went through.
Yeah.
Before putting together even a single page of this book.
Yeah.
How did you keep yourself motivated? Most of us have this plan of, I want to write a book someday, and it never materializes, leave alone having hundreds and hundreds of papers that you went through, which was incredible at a difficult time. You know, COVID-19 was a difficult time with the pandemic. So what kept you going? What was your inspiration?
Well, I think things happened to me naturally. I was just crossing 50 years of my life. And I was diagnosed with diabetes, and I was looking for alternative options. I did not want to take medications. I'm a nuclear medicine physician, so my own colleagues, I closely interact with endocrinologists, particularly. We do thyroid scans and we treat thyroid cancer. And most of them, all of them gave me the same medication, the same dosage. They said, start this for 3 months. If the numbers don't go south, we will either increase the dose or we will add another medication. I looked at the medication, metformin. I turned it over, the side effects, bitterness of the mouth. I could feel it even before I actually took the medication. So that's when my quest started. I came across lifestyle medicine, which is a subject in itself, works on the 6 pillars of lifestyle. Kind of awed and appalled in a way that this was never really inculcated in our early medical education, if you will. So after I started reading and understanding more and more of this, there was no turning back. I was making my notes, I was studying for my exams, and then I cleared the boards. And I was also in parallel seeing results on my blood tests. And then I was starting to tell my colleagues who had initially prescribed these medications to me, saying that, hey, you know what? My sugars are in control. I don't think I need medications. I'm not taking it. Some of them thought I was crazy. They said, you're not doing the right thing. You're, risking your kidney. You're risking your eyes. So you need to be on medications and such. And they wouldn't believe me when I said my hemoglobin levels it was like 7.2 and it came down to 6-ish about. And I've been able to maintain it, except for some short periods of travel or any other related stress. It's been in a bracket where I don't really need to take medications if I watch very carefully and if I'm very diligent with my lifestyle. And then a lot of questions from them. How did you do it? How was they themselves were surprised? And that's when the book started, started putting down the points. And one person I explained, the second person I explained. And then I said, you know what? I'm going to just give you a book here, read it. So that's been my journey. And when you're saying something, you really need to have the right validation to it. You need to bring in the references. And we as doctors, it can't just be anecdotal quotings. So kind of categorized my thoughts, put it into different buckets, and then what would go where, and then deep diving into each section. That's how it came through.
So what was your favorite part of the book?
I think it's hard to say. So basically, the book starts with my journey, starting from nuclear medicine, where we mainly deal with the functioning of the body. Every, a CT or an MR shows you the size or the shape of the organ system, but we actually see how it functions. For example, kidney, there are 3 different phases, right? Excretion, extraction, perfusion phases. So we can split those functions and we take a deep dive into that. Similarly, every organ system. So that's functional imaging to lifestyle medicine or functional medicine or integrative medicine. So that's been the leap for me, where I started not just be in the diagnostic or the therapeutic space where we are diagnosing diseases or we are putting a label on it, and which helps us sometimes treat ourselves, or we guide the physicians who are going to be treating with what category they need to take the clinical pathway forward. Now also looking at with the preventive aspect, which kind of brings in the holistic 360-degree approach to the entire health ecosystem. So it starts with that, and then I take you through the 4 major chapters around food. And the whole idea has been to kind of make it suitable to an Indian palate. I think food is the major pillar in lifestyle medicine, and it's very regional. The palate is not the same. Everybody likes a different kind of food. So how can I adapt the balancing of the plate or whatever macronutrients and micronutrients available easily in India? That has been my goal, to kind of thought process the American or the European guidelines and then see how we can make it available to the Indian population. For example, kale or broccoli are super foods, of course, but not so easily available in India. And even if it is available, half of my patients cannot afford it. Even if they could afford it, even if they cook it with it, they wouldn't know what to make with it. Even if they do, half the family wouldn't eat it, right? Mm-hmm. So if you kind of balance out the similar micronutrients, which grows very easily in the tropical climate, with heirloom seeds, what is local, what is fresh, and what is seasonal, bringing in those alternatives was the starting point. And that's what we cover. I cover in the first 4 chapters, mainly around food. And then after, it's like exercise. What kind of exercises can you do, and which would work best for what kind of pathology or a disease kind of a state? And then we take you through sleep hygiene. What are the parameters of sleep hygiene? Stress management. What is, stress, eustress? How do you be in the flow zone? And of course, positive psychology, which you are the expert. So I'd like to talk to you more about that. And last but not the least, substance abuse, where, alcohol, smoking, and more recently, I think even food itself is an addiction. And I am guilty. Yeah, I think I was in a way addicted to food, sugar, the dopamine kicks, and which has been recognition and a revelation in itself, trying to first become aware of it and then slowly, cut it down and make those changes where you develop not just the willpower, but also the skill power. How do you do it? So that's been that part of the book. And then later on, we go into different chapters. There's one chapter on diabetes, one chapter on hypertension, heart disease, cancer, brain, Alzheimer's, which itself is diabetes, type 3, being called that, gut health, so on and so forth. I think now that you're asking me, I'm still going through all the chapters.
I just wanted like a very simple look at what was your favorite thing. I like to understand the journey of the writer.
Yeah.
So what was the best, or what was the one that you got the most feedback for? So just like in short, if you have like one chapter that, oh my God, people came up and told me.
Yeah, I think it would be Food for Thought, or Soul Food, I think it's called. I don't remember the chapter name. It takes you through the comparisons of Indian spirituality to the modern, technical advances. For example, gut microbiome. Mm-hmm. We have always known this. Like my grandmother, she would never allow us to exchange spit, right? I mean, this is an Indian culture. So they knew there is something which is growing or which could be shared, or even when we clean the plates, that whole area is, in Canada, we have a specific name for that, angel, we call it. And that cannot touch the other person's plate, or these kind of things. Multiple things. So we have drawn corollaries, like what we have learned naturally, be it predominantly vegetarian food, or having a lot of pulses, or having a lot of seeds and nuts in our diet. There might be even like an Ayurvedic component of therapeutic foods, which are healing and, immunity boosting, and which are not necessarily medications per se. But I think exploring those things and making those connects, I had a lot of fun there. And it was like, I was like, oh yeah, you know what? This makes sense now. And I'm finding new meaning to what I was just taking for granted. So yeah, I think that would be my favorite chapter, which I enjoyed. And people have told me, I never thought about that. So yeah.
Considering that this is going to be in an audio format on Apple, Spotify, you name it, wherever you find your podcast. And not everybody will have the time to go read the book. So you said you found alternatives for kale and broccoli. What was the alternative?
So how we have done it is there's an entire picture. There is Malabar basale. It's like Malabar spinach. It's a local grown spinach.
I grow it.
Yeah. I saw your beautiful garden. Wonderful. Yeah. So I really liked your spice box where you have all just the herbs growing, and you can just pick up something and bring it to your kitchen, like we did. We picked up fennel seeds, which have digestive properties, and we can just have it after dinner. How wonderful is that, right? You're blessed, to do that.
So Malabar spinach, so it comes in like karma and dharma variety. So it's red stem, green stem. Does it matter?
Right. I think the phytonutrients, I haven't done my research there, but colors are very important. You need to eat a rainbow. So I guess the red would substitute for lycopene or something which is, redder versus the green component, I think. And a lot of Amrita Balli we grow. A lot of local herbs like Brahmi, water Brahmi grows it's very rich. Moringa, we have a moringa tree, which is like all around the year. You can get the leaves, you can get the pods, and you just have a tree and it gives you nutrition year round. So a lot of alternatives like that.
Wonderful.
And also I have made a tabular column where which dish would go best. For example, basle. It has a slimy texture to it. So dishes like what we typically cook in South India, like pongal or bisibelebath, which has like a creamy, like a cheesy kind of, consistency, that would take these kind of herbs very nicely. If you put it in sambar, you will not like it. Nobody, this kind of things where people can use whatware and kind of,
Yes, sambar. I'm glad you brought it up. Sambar is like my easiest way of incorporating amaranth. Or kale or chard, because, you eat it, you don't even realize it because the dish is so flavorful.
True.
And especially if you have either zucchini or oppo growing, it's farm to table that day. It's just
absolutely
beautiful.
Absolutely.
The taste is, it's difficult to describe what the taste is. It's just alive. It has that prana value.
It has Sattva. Actually, it's called MindSattva, coincidentally. But that makes sense.
Yeah.
And a good thing to do is, if you're having greens, recently I'm just trying to get into hydroponics where you can have it much more grown much more easily. But you can grow it like if you do like how you do organically without any, pesticides or chemicals. And always add it just before you add the tadka. So you don't really cook it from the beginning. Like usually we cook with, pulses and vegetables together, right? In your pressure cooker. After that, that's when you add, because it just takes like a minute to kind of.
It just needs to be steamed.
And
it doesn't need to be overcooked.
A whole bunch, it just becomes like.
Yeah, absolutely. Oh, what about like kirai and those? I get those seeds sometimes.
Yeah, we should try. I haven't tried. Really.
Yeah, they also come in like so many different colors. Similar to amaranth, but it's a much softer leaf.
This is the Andhra.
I don't know. I just not that one. Sure. But it's even softer. It's similar to amaranth, but like a smaller leaf of that.
Okay. There is so much variety in Indian leaves. Actually, you have these carts of vendors, right? In the morning, they bring all these fresh.
I know,
more than 20 varieties. More than 20 varieties, and even more variety to make your smoothies, or you can add it in any dish you want. Sandwiches, or you can make a puree and make the atta for your chapatis. You can make green chapatis, and so much variety. And you can experiment and have fun.
Wonderful. Oh my gosh, I could keep talking about food all day. This is fabulous. Right, this is number one conversation in Indian households. So what are you going to have for lunch or dinner?
Right.
And what are you going to have next week?
Yeah.
So I think what you're doing is vital, because the moment you mention lifestyle medicine or cooking a certain way, it's like everybody's shackles go up. It's like, oh my gosh, using only a little bit oil or no oil, or like cutting down on any other part of your diet. It's like unthinkable. It almost is as if like you are rejigging their whole entire matrix. People are absolutely resistant. And first of all, they think you're crazy.
Tell me about it. Totally. No, people will. I have had a patient tell me, I will change my religion, but I cannot change my food habits. It's that strict, right?
Yes.
So it's hard. It's hard.
It's also a little bit colonial hangover, right? If you had money in the times of when we were ruled by others, that's the only time you would have access to oil, access to ghee. And so it has continued to represent status in our society, whereas we are facing a problem of like either starvation on one side or diabetes and obesity on the other. So we have the split situation. but we are still going with the older tropes, and these are bigger problems to do. What does change is if depends who in the family is sick, is what I'm saying.
True.
If it is the patriarch of the family, then all the changes will be made. But the other members, whoever may be, they may not be that easy to make changes because the whole family doesn't gather around them.
It's I think it's very important, especially for women, because they have been traditionally, the food preparation team of the household, and they also need to take care of themselves. There's this famous food historian, Pushpe. Sorry,
You can write it in the comments.
I think. I'm P. Pant, I'm not remembering his name properly. But he says that, the chutneys, which India is so famous for, how it originated was because of this, what you're speaking about. The men would eat and there would be only rice, but no condiment or like a sambar or a dal left over for the women to have. So all they could do is just grind up something spicy or something tangy and mix it with that and, eat the rice part. And we are known to be grain heavy, and that goes. And they always the first preference or the priority was given to the breadwinner.
Which at a time where famines were so common and money was so hard to come by, it's a survival instinct.
Absolutely.
They live to tell the tale.
Yeah, absolutely.
Right? And I think we are here today having this conversation because of the sacrifices the previous generations.
Absolutely. And talking about famine, I think there's so much research which shows the impact, the epigenetics, right? That's one of the reasons diabetes is so prevalent, because the genes are in a way programmed to hold on to food or eat more food or, hold on to energy, because that's the survival instinct, right? So it's amazing how what happened 7 generations ago can have an impact on us today and the future generations too. So it kind of brings in that even more importance to us to be diligent about the choices we make. So what we choose today is going to carry over for the future generations.
No, I agree. I mean, these are very important topics and we can go on and on. I did want to make a mention as far as you had mentioned food addiction. Food addiction as such is still like a condition under study. We know that you can get addicted to something called as ultra processed food. So those are like the Frankenstein versions of the foods that are meant to nourish us. But it's not pertaining to all food. So the work right now going on as far as the food addiction criteria are concerned are about the UPS or ultra processed food. And I have to make this distinction because the other side is also very common. You listen to a lot of dietary advice or misinformation. Like you said, doctors, we will keep checking and checking and checking before we utter a word. But there are other people out there who will read a little bit and, for ease of education or for the reason of the algorithm or for external factors, I don't know. Algorithms are difficult, right? They will make it pop in a certain way, and somebody who's listening to it can take a different meaning out of it, and this can give rise to more eating disorder behaviors, whether it's anorexia nervosa or bulimia. So you may have disordered eating, you may have a little proclivity, a little bit too much to, rasmalai, but that does not mean that you have eating disorder or a food addiction.
Right.
So these are all very difficult, very intricate clinical diagnoses. And unfortunately, even those are like bandied about. And I think it's a little bit of the algorithm for social media. It only has to pop in a certain way. So even if the person who's knowledgeable, they have to make it into like a 10-second thing to hold your attention. So it gets blown up in a different way.
I totally hear you. I think, it's marketing basically where somebody is profiting at somebody else's folly. Or I think I worry about that with my own kids or my own generation, future generation also, because there is so much industry influence. The multi-million-dollar companies for processed foods, they are in a way hiring food scientists, just like how our we have pharmacists in the hospitals, right?
Yes.
They have these people on their payroll who come up with this perfect concoction of SOS, salt, oil, and sugar, which hits that sweet spot, the dopamine spot, and which kind of lights up the brain in the same way where people taking amphetamine, addicted support.
I think we should not go there. I don't know if it, no, absolutely.
So
I don't think that the research has, I see addiction on a day-to-day basis and devastates people, especially amphetamines. I think we are talking about very different pathologies.
I see.
When we talk
you
about
probably know more about that.
Versus like a very difficult substance use disorder such as methamphetamine or any uppers in general are very difficult to treat.
But it was interesting to me that it lights up the same centers. There should be some.
Be. So it might be like 1x versus 20,000x. So that, but doing the corollary that, blah is equal to blah, I think it will be a little bit reductive. They all have their own patterns. And I love the fact that you brought up the trauma, because we don't even know how that is playing into your affinity for certain foods, because we didn't know 7 generations ago if the colonialists are even in creating artificial famine so as to, put up their stores in Europe.
Of course.
So it's interesting to say the least. I think there are many fantastic researchers doing the work, and I would love to hear what comes next, right?
Of course.
So I'm going to switch gears a little bit because I want for our listeners who are not medical professionals, right? MindSattva is for everybody. Explain to me, what is nuclear medicine?
So nuclear medicine is a bit of both, I would say, radiology, which is imaging, scanning, and also internal medicine, which is treatment. So we do a lot of diagnosis and some treatments. How it differs from radiology is, in radiology, you shoot radiation from outside, externally. There's like a CT scan, a beam coming through, or an X-ray coming through, and then the images are captured on the other side. The radiation given is external. In nuclear medicine, it's internal. So we either give it orally or we give it by IV or any which other way we can possibly get it inside the body. And then we have special cameras which capture the radiation. So giving these radiopharmaceuticals, it's the pharmaceutical which is tagged with a radioactive ligand that requires special licenses. And this has to be done in a very safe and a protected way, and quite sophisticated, I would say, which requires special licenses. And that's what's different in nuclear medicine, where we are not just doing imaging, we are also interacting with the patient. For sometimes our scans can last over 3 days. So it's not just you come, you take a CT, MRI, and you're done and you're sent home. We give something, we follow it throughout the day. We can do gut transit studies, or we can do kidney, we can do myocardial perfusion studies, where we not just look at the heart blocks. If you're looking at an angiogram, right, you're looking at what is blocking. It's like what blocking, right? What we look at is, if you open the tap, is the water actually coming or not? Perhaps the collaterals have opened up, giving that blood. Or perhaps you have some kind of plaque, which is a soft plaque, which is the blood is still passing through. Multiple possibilities there. Or there is like some other way the blood is not compromised. So you might really not need that plasty or an angiogram if you look at it that way. And at a different level, we also look at the cellular metabolism of glucose within the heart cell. So say there has been a myocardial infarction and that thing was shut down, the part of the heart, but is it salvageable? That's what the cardiologists want to know, right? So is it still alive? So if we go reperfuse it, can we bring back that function? If we can, how much of it? So we look at the functioning part of it. And mainly PET CTs, we do cancer staging, how far it has spread. It is the glucose metabolism in the cancer cells we trace. So that's how it's different from radiology. And in nuclear medicine part of it, we use radioisotopes to treat as well. We were using it to diagnose smaller doses. We use bigger doses to treat cancer, thyroid disease, and in cancer, mainly prostate, we do PSMA therapies where it's the prostate-specific membrane antigen. We tag it with that. So there is no collateral damage, like if you were giving radiation to a patient from outside, if they are giving for lung cancer. So everything around it could be damaged. It could be a lymph node, it could be breast tissue, it could be lung itself, fibrosis. So many things in that path of transit could be damaged. But here, the beauty of it is we give it internally. So it goes and sits where we want it to sit. And then it radiates.
So this is precision medicine.
Absolutely. It has always been, yeah. So thyroid cancers,
Wonderful.
we treat liver cancers where it's not just radiation therapy. We can combine it with chemo agent as well. So it's chemo, radiation, and embolization. So it cuts off the blood supply to the, it's different ways. So that's what the treatment aspect of it is.
So 20 years ago, what would have been a death sentence now has targeted therapy is essentially what I'm hearing.
Theranostics is the future. Absolutely. So any chemo agent, which chemotherapy agent, not any, some of them at least for now, if we can tag it with this, we can treat it better or stronger, if you will. Yeah.
So I'm going to be a little playful here. So it sounds like you have the keys to the kingdom and you can open all of these lock cells and, benefit the patient. Then why lifestyle medicine? You can just go and help
prevention
it.
is like, always better than cure. So I think, why not? I think that realization, fortunately or unfortunately, has taken me 25 years for that bulb on moment, I guess. But why not prevent even before diagnose or treat it? So I think that's been the paradigm shift in healthcare, right? So,
yes.
Yeah, I mean, we need to stop mopping the floor and we need to turn off the tap or, build bridges, like they say, build fences and not just be waiting in your ambulance to, the patient is falling off the cliff and you're taking them to the hospital. Instead of that, just build a fence so they don't even climb on the cliff. So,
oh my gosh. But according to troll number 53,945, doctors are evil and they profit off of all of this, right? So why prevent it?
So much for social media. I think everybody is a guru. And well, that was one of the reasons I wrote this book, because it's basically for health coaches where we have dietitians, though I personally believe nutritionists or dietitians, food is never something which needs to be prescribed. If you understand it right, you can be, your own advocate for your own health. And in Canada, where I come from, a South Indian town, Karnataka, there is a saying which says, Uta balavaniಗೆ ರೋಗವಿಲ್ಲ, meaning the person who knows how to eat knows no disease. And ಮಾತು ಬಲ್ಲವನಿಗೆ ಜಗಳವಿಲ್ಲ means the person who knows how to speak has no fights or like there's no
diplomacy.
Oh my diplomacy. So I think it's like I said in that chapter, my favorite chapter, I said, there are so many things which are like common sense in a way, which is not so common anymore.
You would think.
Yeah.
No, that's wonderful. And your journey started with your own illness. So I'm going to bring up our book together, which is How Healers Heal. And so you have a chapter in it, I have a chapter in it, and our own journeys of how we discover lifestyle medicine. How was the writing for How Healers Heal? How was your journey?
It was pretty much very similar. I think it was more fine-tuned to what my initial, because there was a gap about a year or a year and a half. And in that time, I had also kind of some thoughts were more crystallized. It's about converting not just how you heal yourself, it's also how you can translate that. So I make it a point now at the end of any patient encounter to bring in the preventive aspects. It's not just in the small print, or it's not just, you need to go take some yoga classes, or you need to eat good food or healthy food. It's healthy food is just like one line. What is healthy food, or how do you actually make it, or, how do you make it sustainable long term? So making those connections in a more fine-tuned way, I would say, is what is for the book. Yeah.
I know when our team was debating sort of the title for the book, I think one of the ones that we were thinking about is like Physician Heal Thyself as a, on the nose, because physicians generally make the worst patients.
Absolutely.
Because we're so busy taking care of everything and everybody else. with our healer instincts that we come last, and especially women
Absolutely.
physicians.
Absolutely.
Yeah. So, and this is 33 women physicians coming together and talking about
True.
their own journeys about, oh my gosh, now
Mhm.
I need to take this seriously. I need to do something for myself.
Yeah,
I'm not
yeah.
happy about it.
True.
I
True.
still want to continue to take care of everybody
True.
else, but then I had to wake up and
Very
smell the
true.
coffee, right?
Yeah. Like they say, you can only pour from a cup if it is full. If your cup is full, that's when you can pour out of it. But if you don't take care of yourself, and I think this is something which I think very important for moms to be kind of like how they say in the flights, right? Like you put on the mask first before you, put the mask to your child or somebody next to you.
Yeah.
It's very important to make sure you are in a position where you can give optimal care to the others. And this is something very common I see in my cancer patients, because everybody is focused on the person who needs ultimate care. And there is a sense of exhaustion which sets in the caregiver team. And if they don't take care or prioritize that for themselves, it's going to be burnout. So they're going to burn out sooner.
No, caregiver burnout is very real.
And scary. Yeah.
Yes. And, we see a different version of that. We do not spend all day with our patients generally.
Right.
I think you do, maybe because of the scan and everything, but most of us see patients for a limited time, and we have a lot of volume of patients to oversee.
Yeah.
And we hear their stories. So
On
it
the
can
contrary,
also
I'll come back to that. Yeah.
we also get vicarious trauma because we hear about some of the worst behaviors that unfortunately the people we take care of have been subjected. And our heart goes out to them. So we have to fill our cups almost doubly. The vicarious trauma, the caregiver burnout.
Absolutely.
And so it is complicated, to say the least.
True. Absolutely. Very true. For me, there is no allotted patient time because it's scanning time. But in our team, we have my nurse or the junior, somebody will have done the history part, and sometimes the patients insist they want to see, and it's never like a 5-minute conversation if you get into this lifestyle medicine space. That's what I have realized.
Oh, my goodness.
And that's when the book came about. Now I say, everything you need to know is in the book. Read it, or you join one of our programs, because it's humanly impossible to give them that, one leads to the other, and to kind of personalize everything. It's humanly impossible. But I use the time just to bring in that awareness and create a touch point saying that, hey, you know what, this is important. Such things exist, first of all. And this cannot be overlooked. And this is something you need to prioritize and do. Even for the medications or whatever else you're doing to work better, you need to do this. So it works, in complementary way.
So since you're the guru of all of these papers, tell me a little bit about breast cancer or other kinds of cancer, and where do you see lifestyle medicine? What happens once somebody was diagnosed with breast cancer, got treated, and we went into remission? What about recurrence rate? Does lifestyle medicine change the situation? Or is there a certain way that you see the studies itself turn out differently?
Sure. So I think lifestyle is very, very important. When you're talking about cancer, it's not so easy because there is different types, different stages, and different time points in the treatment course. So at diagnosis, during treatment, after treatment, or a stage 1, 2, 3, 4, or which organ system. The TNM classification itself is so diverse, and in lymphoma itself, we have more than 700 types of lymphoma. So it gets very, very complex. But body weight, having exposure to alcohol, tobacco, of course, everybody knows. And multiple factors, even with coming up with you asked me about breast cancer. There is a lot of new emerging research coming, which I'm really looking forward to be reading. What I can remember is there was a group of patients where they had 2 cohorts, one who did lifestyle modifications and one who didn't. And with lifestyle modification, it was predominantly plant forward, and other stress reducing, few other research proven techniques. Which directly or indirectly can affect the gut microbiome, can affect the stress levels, multiple things. And the recurrence rates, when you compare these two, was significantly lower. We still need long-term studies, but it's common sense to me, because when you look at milk, there is IGF, which is insulin-like growth factor. There is casomorphin, which itself, it's an addictive tendencies to it. So there are multiple things which are happening in an animal product or an animal milk, which is supposed to feed and nourish a different type of a
Baby cow,
mammal.
yeah.
Yeah. And look at the size in 1 year, how big it can get on just that type of a food. And then we are constantly bombarding our organ systems with these kind of, and you have the hormone dependent of cancers, and you have the fiber type of colon cancer, where again fiber, these are the corollaries I can very easily draw, where the touch points for lifestyle medicine is with food, of course. So in cancer, what are we looking at? There is the carcinogenic impact and the nutrient density at a tumor terrain level, which is helping us fight it back or kind of reboot the immune system, right?
So what is tumor terrain?
Okay, so tumor terrain, so there are hallmarks of cancer, there are different pathways, and tumor terrain is in any body at any time, there are known to be cancer cells, which there is a process of the autophagy or the body's housekeeping processes which takes care of it. There is the immunity is so robust that the body fights it naturally. At some time, there is a switch happens. Either the mutations are stronger because of the carcinogenic impact, something is hitting the mutations happen over and over and over again. So that is stronger. Or the body is not strong enough to fight it back. There is an imbalance happening there. So what can you do? So anything you put into the body which has a carcinogenic impact, which could be the food you eat, the air you breathe, the water you drink, or personal products which you use.
Oh my gosh, that is like limitless nowadays.
And anything can cause these kind of, it need not just be alcohol or tobacco, right? So anything which can disrupt that is giving this constant insult to the body, which is hitting like for different types of lung cancers, but just, 11 mutations for that to actually turn on. Think of it like a hit. Every time something is hitting or you're, putting a scratch over scratch over scratch, that's what happens.
Sometime it's going to give way.
Yeah. So either you stop that. How can you stop that? You have to recognize that. Or you stop that, you recognize it, and you put in a protective layer of something which will help that. And even if it were to happen, you make sure your things are built strong to fight it. So how can you do that with good nutrition? How do you, with good exercise itself is like good housekeeping. It's like, you're not letting your body rust like a car. You need to keep the engine running. And sleep, of course, restorative sleep, which is when all your hormones are produced and you are recharged and you're ready to go. And stress, that is the single most important factor for cancer at a different level, cortisol level and emotional, so many, we can just go into that.
Oh my gosh, we should do a follow-up just on stress.
Just on stress, absolutely.
Yes, because cortisol, I work on all of us.
Yeah. All of these things, there are definite touch points where you can kind of customize it and personalize it to that type, stage, and time point in the cancer treatment journey, and see what would be the best and the easiest things for them to do, because it's very hard. It's very hard to be doing so many things. If you can kind of prioritize for this top 3 or top 5, and then you kind of hit on that, it would make that journey towards wellness much smoother and faster, I feel.
Yeah. No, this is wonderful. It has been an amazing conversation.
Yeah.
Mythri, is there anything you would like to add, something that we were going to cover that we didn't cover?
I think that's it. I think it was fun, really fun talking to you. And happy to answer any questions or...
Yeah, that would be wonderful. I think maybe we should plan a YouTube live or something at some point where people can come in and actually ask questions. But it has been a pleasure just having you on MindSattva, and I'm just looking forward to when the final edits and the episode goes out. And we will have links to all of our handles. We will have links to the books, and please follow both of us.
Yeah, that'll be great. We will do that. I'll share it on my links too. And we do have a new program coming up for cancer patients.
Yes, tell me a little bit about that.
Yeah, it's about a 21 session program where we take them, like I said, to all of these key points where not just the pillars of lifestyle medicine. We also cover the gut microbiome, which could also be related to many of these pathological processes, detoxification, cardio-obesity, insulin resistance, hormonal imbalances, food intolerances, the whole enchilada, because only 5% of cancer is genetic. The rest of it is either lifestyle or environment related. And there's a lot we can do to prevent that. And I think that should be the focus for all of us, where we can prevent not just primary, that is before we get primary prevention of cancer, before anybody gets cancer. Secondary, in terms of somebody has had cancer, but they want to make sure they're doing everything possible that it does not come back. That is secondary cancer. I do PET CT scans. That's what I do on an everyday basis. And we see more than 10% of it is second or dual malignancy. So they've had type A, and then they're having, like, for example, somebody with thyroid ended up getting rectal, which are not at all related. It's not metastasis.
And it's not like even a men's syndrome or anything.
No, it's not a syndrome.
Wow.
So about 8 to 10%, there is documented evidence that is happening because of the environmental toxins. So getting that recognition and
heartbreaking to have two diagnoses.
Yeah.
Incredible. Oh my gosh.
Yeah, we see it all the time.
Oh my gosh.
Yeah.
So this program is for other doctors, or is it for family members, caretakers?
Anybody can do that. We have a health coach certification program also through the foundation, where sometimes we give them scholarships and we give them employment within our program. That's been quite doing very well. So we train them to sing the same song in the same tune, which is the EASE protocol based on the Lifestyle Medicine, American College of Lifestyle Medicine guidelines, and a lot of other research guidelines. There is many other.
Because you are so niched out with nuclear medicine, so you have seen very much in deep compared to like generic. Advice.
So we kind of train them so they don't deviate and give some, other type of a yarn. And then we also have very generic. Right now, the program we have is for all cancer patients, and then that's the basic program. And then we have for breast, thyroid, and colon, we have specialized add-on kind of things which they can choose based on the stage of treatment they are, or if they are in remission, or that has to be, there is like a clinical checkpoint which happens there. So there is no wrong type of guidance, or they're not, it's a very delicate phase. They should be doing different things during treatment. They should be doing different things after treatment. And in remission, there's a phase which is all completely evidence-based and physician-led, I would say. So this is available for people who do it.
Especially you want one go and you want a resource.
I think everybody should, patient caregivers. We had a free version of it released on World Cancer Day. We had more than 100 people register for it within first 24 hours. And in that, 20% were doctors. So,
that's great. So you're paving it forward, right? Wow. So I know that you have a TEDx talk, but sounds like you have a second one building, just listening to all this.
I hope so. There's not much time, but eventually one day.
Yes. Again, this has been a fabulous journey. Just having this conversation, I think we can go deeper with stress or one of the other pillars in the future episodes. But again, thank you so much for being on MindSattva.
Yeah, sure. Thank you. Thank you very much.
Yes, thanks.
Thank you.